We are all facing the global pandemic COVID-19. I'm very interested from the beginning how can a mathematical model for COVID-19 can be used to find the appropriate date of reopening after the lockdown. What would happen if the country reopened on a specific date? Will the pandemic be out of control? Can the healthcare system cope with the projection of cases? Not just an improved model, we created a user-friendly app so that anybody can use it, without requiring the knowledge of mathematics and programming skills. When you put the reopening date after lockdown here and the percentage of Malaysians who will follow the SOP here, the model can project how the outbreak will progress. This is the percentage of people who practice 3W, wash, wear, warn, even after the government has lifted the lockdown. For example, let's simulate the model if the country reopened on 22nd of September 2020 and 50% of Malaysians abide by the rules. This graph showed the trend line of the cumulative number of infected people. The real data of the number of cases was plotted by the black square symbol. The prediction is shown by the curves here, which forecast at a time longer than the data points. To know the prediction value, you can click along the line here. Novelty and originality. Number 1. This is an improved SIRD model. Number 2. The basic reproduction number estimation is based on the percentage of people who follow the SOP. Number 3. We created the GUI application. The mathematical concept behind the app can be explained by using an improved SIRD model. The total population is divided into 4 categories. First, we have S, which is equal to susceptible. So this will be the people who could potentially catch the disease. Then we have I. This is called the infectious. This will be the people who currently have the disease and can infect others. And then we have R. R stands for recovered, and this is the group of people who have already caught to the disease and have now recovered from the disease. D is the number of people who have died from the disease. The infection rate, recovery rate, and death rate parameters were formulated as time-varying piecewise functions. This table shows the comparison of sum squared error SSE for the SIRD model by various researchers. Different researchers use different functions of infection rate, recovery rate, and death rate. Their functions were explicitly applied to the case of COVID-19 outbreak in Malaysia. Our proposed function that was listed in the last row had produced the smallest error. From the finding, our proposed function clearly improved the fit of the SIRD model as compared to other methods. We produced the closest similarity between model and data. Applicability of innovation. Number 1 is for Ministry of Health and number 2 is for Majlis Keselamatan Negara. Technology readiness level, we are in TRL 5 where our GUI application is ready to be validated and demonstrated, especially for Ministry of Health and Majlis Keselamatan Negara. The GUI application is also could be generalized to worldwide. Therefore, the potential market for this GUI could be wider, not limited to Malaysia. We received some feedbacks. Professor Dr. Lokman Hakim, a professor of public health at the International Medical University Kuala Lumpur, mentioned that our analysis is very important to help the government in managing the Recovery Movement Control Order RMCO or Perintah Kawalan Pergerakan Pemulihan PKPP. He said that our proposed model supports the 7 strategies in RMCO, especially in embracing the new normal and community responsibility empowerment. His opinion received support from Dr. Sabarida Ismail, a senior lecturer at University Kuala Lumpur, Campus Cawangan, Royal College of Medicine, Perak. For publication, we submitted our paper to Infectious Disease Modeling and ISI Index Journal.